A call to collect race-based data in our healthcare system. CityNews has profiled rapper John River and his nightmare medical experience. Now he's calling for change and an end to systemic racism in healthcare.
I spent 60 days blind, screaming, withering in pain, being patronized. Best case, they left me to die. Worst case, they tried to kill me.
It's hard to imagine what John River went through.
I've been ready to die, I've been ready to fly.
The award-winning rapper had a spinal tap in 2017 while being treated for an illness. He says doctors warned him it could cause a brain fluid leak. And when that actually happened, no one would help him, and he suffered in agony for weeks. River says at one point he was accused of faking his pain for drugs.
People ask me why I think I experienced racism in the healthcare system. The same reason why I'm 4 times more likely to get stopped by the police than any white citizen in this room. The same reason why black kids are suspended more in elementary school, in middle school, in high school, while we're 3 times less likely to be considered gifted in those same classrooms, and while we're more likely to get longer sentences for committing the same crimes.
Today at Queen's Park, the NDP agreed with River and joined him in calling for race-based data in healthcare.
If we do not fully understand how racism in general and anti-black racism in particular operate in healthcare, we will never achieve health equity across Ontario.
There are studies that show black patients are treated differently. For example, in 2015, the University of Virginia found a racial bias in pain assessment and treatment, and that black Americans are systematically undertreated for pain relative to white Americans. The NDP argues collecting race-based data could expose discrepancies and uncover more potentially life-saving data. John River is also calling for more funding to help young black children become doctors.
Until we have more black doctors, we need racial bias training for the rest of the doctors that we currently have.
Now, I asked the Office of the Minister of Health if she would consider collecting race-based data. I received a statement back saying healthcare organizations do not collect it because of Personal Health Information Protection Act considerations.